Just a Few Facts podcast. What you really need to know about monkeypox.
Who's got the pox?
Hi, everybody. Today we're focusing on the topic what you really need to know about monkeypox. You know, monkeypox, or also called mpox, has been getting a lot of attention lately. There's a lot of information out there, but what do you really need to know? That's what I'll be covering today in this episode, all based on the trusted CDC guidelines. So let's get started. Does mpox go away on its own? First off, let's talk about recovery. You might be wondering if monkeypox is something that just goes away on its own. Well, according to the CDC, most cases of monkeypox are mild and do resolve on their own, typically within 2 to 4 weeks. That's right, your body can usually handle it without needing special treatments. But while you're recovering, it's super important to rest, drink plenty of fluids, and take care of yourself. It might take some time, but most people do get better on their own. So, are you immune to monkeypox or mpox if you've had chickenpox? Now, here's something a lot of people get confused about. If you've had chickenpox, does that mean you're immune to mpox? The CDC clears this up for us, and the answer is no. Chickenpox and mpox are caused by different viruses. Chickenpox comes from the varicella zoster virus, while mpox is caused by a pox virus. So having chickenpox in the past doesn't give you any protection against mpox. Is monkeypox itchy? Let's talk about symptoms. One question people often ask is monkeypox itchy? Well, according to the CDC, yeah, it can be. The rash that comes with monkeypox usually starts as red spots and then turns into blisters, which can be pretty itchy as they heal. But try not to scratch, because scratching can make these things worse, and it can also spread the virus to other parts of your body. So, as hard as it might be, keeping your hands off the rash is really important. So, what age is most affected by monkeypox? So, who is most at risk? Does monkeypox affect certain age groups more than others? Well, the CDC says that monkeypox can affect people of all ages. While it's historically been more common in children, recent outbreaks have shown that adults are also at risk. This means that no matter what your age, it's important to be aware and take precautions if you think you may have been exposed to the virus. What about showers? Can you shower with mpox? When you're dealing with a rash like monkeypox, keeping clean is important. So, can you shower if you have mpox? The CDC advises that you definitely can and should shower. Just be gentle with your skin, especially around the rash. Use mild soap and avoid scrubbing the blisters. And remember, washing your hands well afterwards is key to prevent spreading the virus. Here's a good question. Can you go to work with monkeypox? Now, this is an important one. What do you do about work or school if you have mpox? The CDC strongly recommends that you stay home and isolate yourself until the rash has fully healed and all the scabs have fallen off. This is because monkeypox can spread to others, especially through close contact. Staying home might be inconvenient, but it's the best way to protect those around you and help stop the spread. Now, prevention is key. So let's talk about something simple but powerful: hand washing. Does hand washing really help prevent monkeypox? According to the CDC, yes. Washing your hands often with soap and water is one of the best ways to stop the spread of mpox. This is especially important if you've been around someone with the virus or touched something they've used. So don't forget to keep those hands clean. What is the death rate of monkeypox? The CDC explains that the death rate depends on the specific type of monkeypox virus or clade. The good news is that the West African clade, which has been seen in recent outbreaks, has a relatively low death rate. Most people recover fully. Still, it's important to take monkeypox seriously and follow health guidelines to protect yourself and others. Here's another question you might have. Does monkeypox require airborne isolation, like some other contagious diseases? The CDC tells us that monkeypox doesn't spread as easily through the air as some other viruses, like COVID-19. It's more likely to spread through direct contact with the rash, bodily fluids, or respiratory droplets during close contact. So while airborne isolation isn't usually necessary, keeping your distance and wearing a mask can still help prevent the spread. Now, if you've been vaccinated for monkeypox, does that mean you're completely safe from it? The CDC says that while vaccinations clearly reduce your risk, it's not 100% foolproof. There's still a small chance you could get infected. So even if you've been vaccinated, it's important to stay cautious, especially if you're around someone who has monkeypox. People often ask if there's a cure for monkeypox. Well, the CDC explains that there isn't a specific cure, but most people recover on their own with supportive care. If someone has a severe case, antiviral treatments like tecovirimat or TPOXX might be used. But for most people, it's just a matter of resting, staying hydrated, and giving your body time to heal. So how do you know if you have monkeypox? The first signs are flu-like symptoms such as fever, headache, muscle aches, and exhaustion. After that, a rash appears, which goes through several stages, from flat red spots to raised bumps, blisters, and finally scabs. If you notice these symptoms, especially after being exposed to someone with monkeypox, it's a good idea to see a healthcare provider. Here's a question that might surprise you. Can you get monkeypox more than once? The CDC says it's possible, but not common. After you've had monkeypox, your body usually builds up some immunity, which can help protect you from getting it again. However, like many infections, this immunity might not last forever, so it's still important to take precautions. How infectious is monkeypox really? The CDC explains that monkeypox isn't as highly infectious as some of the viruses, but it can still spread through close contact, especially if you touch the rash or blisters of someone who has it. It can also spread through contaminated objects like bedding or clothing. So while it doesn't spread as easily through the air, it's important to be mindful of how it can be transmitted. Finally, how long does monkeypox last? Mpox usually lasts between 2 to 4 weeks. The rash goes through different stages before it heals completely, and it's important to wait until all the scabs have fallen off before you consider yourself fully recovered. Even though it can take some time, most people do recover completely and go back to their normal lifestyle after the virus runs its course. So there you have it, what you really need to know about monkeypox, all based on CDC guidelines. Staying informed is one of the best ways to protect yourself and your loved ones. If you found this information helpful, don't forget to subscribe, comment, share, and turn on your notifications. And as always, stay curious, stay informed, and keep seeking the truth. Your health may depend upon it.